Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Shruti Jain with us. She, after doing her MS in Obs Gynae, has also done fetal medicine as well as genetics, and is practicing as a fetal medicine and genetics expert in Noida. Her experience of doing both the kind of super specializations and how has it helped her to become a better practitioner out of that is all we are going to discuss today. So welcome Dr. Shruti to the platform. It's really nice to have you here and to understand about these two amazing branches that you have pursued.
Thank you, Dr. Ayushi, for having me here. And I must congratulate you. You are doing a wonderful job creating such online platform. Where it can be really difficult for people who have just passed their post graduation, and especially those coming from a non-medical background. So creating such online platforms is really a very good idea, and I think it will help a lot of people. Thank you so much.
Yes, thank you so much for actually motivating me to do more. So let's start with the discussion. How has your journey been till now? How did you plan to do both of these, and how did it go?
So my journey is very interesting and was little unplanned. So after doing my post graduation in Obs and Gynae and after doing SRship, I had decided that I want to do some super specialization. But back then, 8 years back, I knew of only two options. One was gynae oncology and second was IVF and laparoscopy. I did not have much idea what a fetal medicine and geneticist does, even after passing out from a very good medical college from Delhi. So some circumstances happened. I happened to move to CMC Vellore. So there I was trying to get into IVF and laparoscopy. Then I got this opportunity to work in genetics. So I thought, let's give it a try. I'll get to learn something new. And then when I started working in genetics, I realized what a fetal medicine and a genetics unit does. So I was really impressed when I started reading about it. Then I got to know that this is my calling. This is something which I want to do rest of my life. I was so impressed. I found it so interesting. So then there was no looking back. After working in genetics, then I did a fellowship in fetal medicine from SGPGI Lucknow. After that, I worked for 1 more year there. Then now I'm practicing as a fetal medicine and a genetics consultant in Noida. And I'm really happy and content with my life.
Nice to know. So now when you mention about, fetal medicine and genetics, what are the different kinds of super specialization also did you look into as a Obs Gynae expert? What were the other branches that MS Obs Gynae can go for? And what is the advantage of doing fetal medicine and genetics?
So there are lots of branches. One is fetal medicine. Then there is you can go for IVF fellowships or laparoscopy fellowships. Then you have MCH in gynae oncology. Now fellowships in cosmetic gynecology have also come up. So there are lots of options, and one can practice as plain obstetrics and gynecology also. There's lots of scope. So basically, what you want to do is it depends more on what is your acumen. I mean, first you have to sit and decide whether you are somebody who is into hardcore surgeries, or you are somebody who likes to read, likes to explore, or likes to make differentials. So first you have to decide that what do you want? How do you see yourself? Do you want to earn a lot of money, or you want to do quality work and have a work life balance? So after you decide with yourself what you want, then you can decide what you want to specialize in. And then you get to know there's a hell lot of opportunities in India, lots of fellowships, but then first you should decide what you want.
That's so true. That's correctly said, to understand what you are looking forward.
Yeah.
So now let's discuss about fetal medicine. What exactly is fetal medicine, and how are you practicing that?
So, fetal medicine is a very super specialized branch. A fetal medicine person role starts from preconceptional counseling. You know, when you have people are trying to plan a pregnancy, if there's somebody with a genetic disease in the family, then how to go about it. If there are people who are already high risk, like if they have uncontrolled blood sugars or some surgery for cancers or some previous event in the past, then how should the planning of pregnancy be like? Do they need to do something before pregnancy? Then there is whole arena of what you do during pregnancy. You do ultrasounds for low risk pregnancies and for high risk pregnancies also. Then like how frequently should they have, and then you, along with the obstetrician, you chart out a plan for delivery, for surveillance and all, so as to achieve a healthy mother and baby. Then you scan previous bad obstetric histories, people with various high risk factors. Then you have twin pregnancies. Then you have lots of interventions, diagnostic, like amniocentesis, chorionic villus sampling and all. Then other procedures like reductions, intrauterine transfusions, lasers, radio frequencies and also there are, and then there is a part of genetic counseling. If you see something on ultrasound of this previous history or something, if comes up on some genetic evaluation, then what needs to be done. So this is the major part which is there. So the patients you get are in-house from your own hospital, or more, and the other part is the referrals. So you get referrals from the obstetricians who've been working around you, and sometimes patients, they try to find out, if they find something, then they find out you from social media or from word of mouth, and then they come to you. So the practice goes like that. And you usually you have standard working hours, straight shifts, and not too many emergencies.
Okay. Okay. So nice to know actually about emergencies, as in gynae it's too much. So now, when you mentioned that all about fetal medicine, what are the best places that a person can go for to pursue that?
So fetal medicine fellowships are there in both government sector and private sector. So government sector, we have SGPGI Lucknow, we have AIMS Delhi, AIMS Rishikesh. Then there are certain FNBs in high risk obstetrics and fetal medicine. It's there in LNJP and in Fernandez also. And then there are private sectors, sorry, which offer fellowship, like there's Apollo Delhi, there's Mediscan Chennai. Then you have lots of fellowships in Bangalore, Gujarat. So, but the major difference is, like in government and private, government sector fellowships are mainly high risk obstetrics and fetal medicine. So you do high risk obs also side by side. So you are doing OPDs also, you're doing ward duties also, you are delivering patients also, you're doing cesareans, you're doing night duties. And then you crack an entrance exam, you go into government setup, and then most of the places you are paid like an SR. So there are 1 or 2 years fellowship in government sector. Private, you have to pay for the fellowship. And then there are different, some places are 6 months, 1 year, 2 year fellowships. And most of them are concentrated mainly on fetal medicine. So there you are not required to do high risk obs and fetal medicine. So money factor is there. Then duration of course is there. Personally, I feel that one should work at least for 2 years in a fetal medicine unit before coming out in practice, because then the amount of confidence and knowledge you get is very different when you do a very short course. So that is there. And then other thing is, you have to decide whether you want to do high risk obs and fetal medicine, or you want to do only fetal medicine. Personally, I feel that I mean, that's my personal perspective, that if you do during training time, if you have a training on high risk obs also, that helps in long term. Yeah. But then there are some people who don't like, who know that we want to do only fetal medicine and we don't want high risk obs training. So that is the major difference. And some private, and you have to crack an entrance, and some private places, they have waiting and all. So you have to start little early if you are planning for fetal medicine. And I would also say that one can, go and work as an observer before taking up as a branch, and see how they are liking the work.
That's so true. So now, when you mentioned about different places to pursue, what are the kind of job opportunities that you have seen in fetal medicine around?
Fetal medicine has lots of job opportunities, and there are opportunities both in government sector and private sector, because there are lots of government hospitals which are coming up with the fetal medicine fellowship, fetal medicine departments and fetal medicine, clinics.
Mm.
So there you, like in a government setup, you get appointed as assistant professor, and then you move to associate. So advantages with government sector are that you get to see a lot of patients, and if you're interested in research, so that gives you a very good opportunity to go ahead with research. And then if one is interested in government job, then that has its own advantages and disadvantages like any other government job. One thing is there that in most of the government hospitals, you are mostly placed in a obstetrics and gynecology unit, where you manage all obs and gynae patients, and then you get to do your special clinics where you can focus more on fetal medicine. So it is not exclusively a fetal medicine thing that you would be practicing in most of the places, uh, in the present scenario. In private sector, also, because it is a new branch, not many people are there. So most of the hospitals, they usually they would need their own fetal medicine expert. So you can either attach with a corporate hospital, or you can start your own private practice. So when you attach to a corporate hospital, you will have your in-house patients, which are being delivered there. So they would be having their antenatal checkups with you, their scans with you, their counselings with you, and 50% or so you will be having referral from around the area if there's something which has come up. So there, but there's certain things that mostly places they would have their just one fetal medicine unit and one fetal medicine person who would be handling all the cases. So only few places would have a team, so you would be mostly working alone. And then uh, research and all, if you are really oriented, you can go on to write some case reports and case series, not too much.
Mm.
But I think work satisfaction is good because you get to do a lot of quality work.
Mm. Correct.
And yeah.
Yes, yes, yes. So nice to know about this. So now when you mentioned about private as well as government, what about, tier two, tier three towns? We understand that metros have this, but do the small cities also, understand about fetal medicine?
The awareness about fetal medicine is coming, that even I am seeing in my practice. Initially people would come only if they are referred to a fetal medicine expert, they would not know otherwise. But now I have seen lots of patients who are coming up because either they have heard from word of mouth, or they are generally aware that they should show themselves to a fetal medicine expert. So that awareness is coming. So in metros, yes, people are quite aware about fetal medicine. Most of the hospitals, they have started having their own fetal medicine expert. But two tier cities, not many people are there, but scope is just too much.
Okay.
Because with the because these people, they don't know where to go. So if like two tier cities, people who have settled there, they are doing really good.
Hmm.
So I think in coming years, even two tier cities would have their own fetal medicine experts, and that would be really, helpful for the doctor and the patient, because the amount of patients a lot, and there is actually a need
Hmm.
people to go there and practice. But I think initial years can be difficult. Few years can be difficult for people to establish themselves, to create awareness. But once that happens, then there is no going back.
That's true. That's true. So now understanding about different kind of practices, what are the pros and cons of practicing fetal medicine that you are experiencing on an everyday basis?
So pros are that it is a very interesting branch. You do a lot of quality work. You get to read a lot, and you go back, you study, you explore, you see lots of rare things. So if you are somebody who likes doing that, then that would make you really happy. Then you get to make differences in people's life, because people, they are sometimes so stressed out, and just a proper genetic counseling and your proper evaluation can really help them go a long way, and can sometimes, and sometimes we save so many lives. So that is a pro, that you get a lot of work satisfaction. And then you have a good work life balance. Then you're not running whole day, you can spend time with your family, you can do things which you like. um, and then it is a referral practice mostly, so people would come when they are referred, so that can be a good thing also, a bad thing also. So good thing is that it feels nice to see them.
Yes,
Bad is that sometimes you feel that you're dependent on referrals.
correct. Mm.
So if you want to do quality work and money is not a big issue, then fetal medicine is a very good branch.
Okay, okay. So now when you mention money is not a big issue, so just if you can mention a bit of pay scale, how does it go? Is it mm, that I believe it must
Uh,
be same as at that of an MS Obs Gynae, or how does it go?
so the in government sector it is same as your assistant professor, associate professor in any other branch. For private, the pay scale is decent. You start from somewhere around 1.5 and then it can increase over the years. It is not a very, very high revenue generating branch, but then it is good to, sustain you.
Yes. Okay. So now understanding about fetal medicine in depth, let us discuss genetics. As you have done genetics along with fetal medicine, how is it helping you, and how in general genetics is, a branch per se?
Genetics is it's good that you if you have a knowledge of genetics along with fetal medicine, because there are lots of genetic issues you deal in your day-to-day practice, like in if you have a previous baby with any genetic disorder, then how to go about evaluation and how to understand those reports and what all exactly and correctly you need to offer in the next pregnancy. And if you're seeing anything on ultrasound which is coming up, how do you correlate it genetically? Or if you have done an invasive test and then the reports come out, then you should know how to interpret it. So it's always good if you have a genetic knowledge. It's not that you need to do a very long course, but a short fellowship along in genetics along with fetal medicine can be really helpful.
Okay. Okay. So now when you mention about short courses and long courses, so what are the kind of courses that you mention in that, and how can people pursue that?
So that depends. If a person, what is your goal in the life? If you want to do fetal medicine or you want to pursue core genetics. If one wants to do fetal medicine, then it's better to go for some SR-ship or short fellowships or certain genetic courses, like that can be done from government or private. And if you are planning to do after MS Obs Gynae, if you're planning to do core genetics,
Mm.
then one should go for dedicated 2 or 3 year courses, like there is DNB and DM genetics. But then after doing Obs and Gynae, if you are going for DNB and DM genetics, then one has to understand that you would be seeing pediatric cases also, and you would be seeing male adults also, you would be seeing geriatric population also, you would be seeing doing cancer genetics also. So there are lots of other things which you would be doing, and you have to be prepared. Some people like doing that, some may not like doing that after doing MS Obs and Gynae.
Mm.
So and then you have to you know decide with yourself what is that what you do want to do rest of your life. Do you want to see obstetric population only, or you want to leave obs gynae and go completely into genetics?
Mm.
Because once you opt and you start working in it, then after 2 3 years, if you feel that no, I wanted to come pursue with my own specialization, then it can be difficult at times. So if just to summarize, if you are planning to do fetal medicine, then short course is a better option.
Mm.
And if you're planning to do work more like a core geneticist, then you should go for long term duration courses.
Okay. Okay. So understanding about what are the then when you mention about DM and DNB as well as some short certification courses, if you can mention some good places that a person can go for.
See, DNB and DM genetics is there in SGPGI Lucknow. They have a 3 year DM course. Then even Delhi, Gangaram, they have DNB in genetics. Then there are other places also, I think Manipal and all, who have started with their courses. So, and then there are certain 1 year fellowships in Mumbai also, where you can go and get acquainted with genetics. And there's some labs like med genome and all, they have their short 2 3 months fellowships in genetics. And also there's an option of working as SR or observer in these institutes. So before deciding whether you want to go for because some people are really confused some whether to go for genetics or fetal medicine after doing Obs Gynae. So they can go and work in these departments for 2-3 months, and then that really helps in understanding what you see yourself as 10 year down the line.
Correct. That's so true. So now, after doing genetics, what are the kind of job opportunities in genetics?
See, after doing core genetics, if you have decided that you want to work as a geneticist, so there are mainly two options. Either you work as a clinical geneticist, so you attach to a hospital. Usually, these are big corporate hospital who would want their own geneticist, or big pediatric hospitals. Or you can get attached with labs. Those There are very big genetic labs which have come up in India and abroad. So you can start working on them, because they also need clinical geneticists with them to understand the reports and to validate them and to provide adequate and accurate results.
Mhm.
So,
Okay.
but since it is a very super specialized branch, though job opportunities can sometimes be limited. You'll have to work a little hard to place yourself in a good place.
Hmm. So what I understand, the most of the job opportunities are there in big cities and metros for the same,
Yeah, as of now, yeah.
as of now. Yes. And when you mention, you have done after fetal medicine, the genetics, has it helped you in your job opportunities as well? Does it help in general?
Yes, yes. It does give you an edge if you have an understanding, both when you are applying for job, and secondly when you are dealing with patients.
Correct.
So that really helps, because then you know you have more control of the situation, of what is happening all around you.
Yes, yes.
Yeah, you can but anyways, if you have any problem, you can always refer patient to a geneticist. But if you have a basic knowledge of genetics, that really helps. So I always suggest to have some short fellowship in genetics before a person starts practicing in fetal medicine.
Okay. Okay, that's really nice to understand
Yeah.
about genetics. So, as you have mentioned about all of the different kinds of, fellowships as well as fetal medicine and genetics, is there anything that a suggestion from your end for the recent graduates who have done just recently graduated from MS Obs Gynae, any suggestion from your end so
Yeah.
that they can make better decisions?
Thing which I mentioned before also, just first a person has to be clear what you want in life, how you see yourself 10 years or 20 years down the line, where do you see yourself sitting, and what kind of work you see yourself doing. So before getting distracted, or by the glamour of how people are doing, that person is doing so good, is looking so nice, is practicing so nicely, before getting affected by all that, one person should first sit with oneself and decide what kind of acumen that person has, whether that person is a surgeon person or a person who likes reading and exploring. And second is how you see yourself, whether you see yourself in a standard hours job, or you like that adrenaline rush of emergencies and all. And how do you see yourself, how much you want to earn, and are you more research oriented. So these things, first a person has to sit. And if you're really confused before getting into a fellowship or a training program, one can always go for a short observership or senior residency in that department, and then understand, well, is it really your calling, or you feel yourself into that department or not.
Correct, correct.
So there is no hurry in life, just give yourself time. First give yourself time with yourself, and then you can go and ask people. It's always good to ask people who are 10 years elder to you, who are already established and practicing, rather than your immediate seniors, because they give you a better insight into things.
That's so true.
Yeah.
That's so true. It's exactly the same what we are doing, understanding
Hmm.
it from Dr. Shruti to actually understand the branch better.
Hmm.
So actually really nice to understand all of this. Any motivational quote from your end that has motivated you always?
So I love those two lines: love what you do and do what you love.
Yes.
So I think that keeps me going. If you love what you are doing, then you will do it with all your passion and heart, and you are tend to, gain excellence in it. And if you love what you do, then there's nothing which can stop you.
That's true. That's true. That keeps you motivated every day and keeps you going.
Yeah.
So nice to know, Dr. Shruti, about everything about genetics as well as fetal medicine, understanding how a person can become a better practitioner following genetics after fetal medicine, and as well as do great for herself and himself. Thank you so much for coming on the platform for discussing about your journey as well as the scope in both the super specializations. You know,
Thank you so much, Dr. Ayushi, for having me.
yes, thank you so much, everyone, for joining us at this time. I'm sure it would have helped each one of you to understand about these two super specializations. How can it help you to become a better practitioner after fetal medicine? So do share it with your friends and colleagues. I'm sure it will be helpful for them as well to understand about this and what they want in their life, and what if they go for this, what are the kind of opportunities after that. So please do share it with your friends and colleagues. I'm repeating it again, as well as do follow us on our YouTube as well as Instagram channels. There you can find all our old videos which can also help you in your career growth. Thank you so much, Dr. Shruti. Thank you so much, everyone, for being here with us. We will be coming up with some really new and interesting videos every Sunday as well as Wednesdays. So do follow us and let us know if you are facing any kind of struggle, any kind of difficulty. Do share it with us. We will help you and guide you in the best way we can. Thank you so much, everyone. Yep. Bye bye. Have a nice day.